So basically, Debbie, you're here today. How many weeks after your surgery? And I did ankle surgery on you recently, right?
Yes.
So how many weeks approximately?
I think about 10.
About 10 weeks.
About 10
Yeah, that's
weeks.
what I would say, maybe
Yeah,
9,
about
10
10,
weeks.
somewhere around there.
So you came to me as a second opinion, right?
Right.
And from what I remember is I think one of your family members said you gotta go and find out what's going on, right?
Right.
Well, tell me.
I had just a regular visit with my GP
Uh-huh.
practice, and it had been 5 months since the injury.
Injury to your right ankle, right?
Yes, and I asked her, what am I supposed to be feeling, because it's not right.
Okay.
And I don't know, never had a broken bone
Uh-huh.
or anything like this.
Okay.
And so she, at that point, said, well, you should be back to normal by now.
Right.
And she ran the MRI, had the MRI run, which is when we found the complete
Tear.
ligament tear.
Right, right. And I'm going to kind of give everybody a history behind you. So you had an injury, and basically the MRI showed that you had a complete tear of the anterior talofibular ligament, right?
That's right.
And I think, you know, when you came to the pre-op, you're very diplomatic, so you didn't tell me all the details, but when you came to the preoperative appointment with your friend, she actually told me a true story how, you know, it was very frustrating for you because for the first 7 months you were treated like, move on, nothing is wrong with you and you're fine, right?
That's right.
So when we found on the MRI that you had an ankle instability due to the complete tear of the anterior talofibular and calcaneofibular ligaments, I went in there and I basically repaired it.
Right.
And you had that Brostrom lateral ankle stabilization procedure, and you just told me that you ran, right?
I did.
And you're only 10 weeks after the procedure. And you know, I'm going to take a video of your surgical side, but basically you cannot even see a scar. And well, how long it's been since you actually ran?
7 months.
Since the injury,
Since
right?
November.
And I still want to advise you that you don't want to overdo it, right?
No,
and you want to take it easy.
It was more like 60-second sprints.
That's fine,
So
but like I'm happy that you're improving, and this is what we're looking for. Like I want next week to be better than last week, right? But you know, you're gonna have good days and some kind of mediocre days.
Okay.
And you know, of course, I'm not super happy about that 7 months
Me
gap,
either.
right?
Me either.
But you know, we have to deal with what we have to deal with. And bottom line is, I think the reason why your video is very important in your testimony is not that, you know, it's Brostrom lateral ankle stabilization is a great surgery. I mean, it is a great surgery because obviously you did so well. But I think the key is if you feel that something is going on and, you know, in your gut feeling you think that maybe you should be better and you're not, go and get a medical attention. And second opinions, I am always a believer in second opinions. Why? Because you know what, yeah, we want to give it time to heal, but if it's not healing and something is going on and it's interfering with your lifestyle, we should not accept it. We should find out exactly what's going on. And look, in your case,
I still wanted to play.
Right. And I don't blame you because you know what, we all do. And age is just a number, right? And it doesn't define us.
No.
And I think that, you know, and your friend felt like, you know, this male orthopedic surgeon like really just said, well, you know, what do you want?
Me off.
Yeah. But I think it's wrong. I think that, you know, basically if you were my sister, I would advise you for a second opinion because I have seen things in my 20 years of practice that are really sad, where people really were misdiagnosed and they paid very dearly for that.
Well, I was afraid I wouldn't be able to continue with the dog running, what I do, what I enjoy doing.
Right, exactly.
I'm retired, I don't want to sit in a rocking
Exactly.
chair.
It's like this is the time. Right now is the
now
time.
Or never.
Exactly. So, well, thank you so much for your testimony. Okay?